Dear colleagues, it's amazing to be with you, albeit only digitally. Unfortunately, I had to be running an event with our local and regional mayors in Sweden and their staff just during this particular time. So unfortunately, I couldn't participate in the beautiful Reykjavik, this beautiful START event. However, it's such a privilege to be able to join you from this end, and I hope to be continuing to work with you a lot going forward. Our work on the well-being economy in Sweden has a lot of experiences during the last couple of years, but it's still a very new phenomenon. We have tried to empower Nordic local authorities and regions with a particular focus on Sweden, of course, and we want to take it further across our Nordic neighboring countries. So our core themes to take us further from a couple of last years of work is to define why an economy for and by well-being. Why empower regions and local authorities, and how can regions and local authorities be supported to develop their own well-being economy approach? In essence, what we're seeing from this great report coming out of the Nordic Council of Ministers a couple of years ago is that this is a complex field that has to be defined by the local contexts and by your own understanding of well-being within this particular situation. It's very closely aligned with the welfare state, and therefore also the Nordic countries are particularly well suited to drive this agenda. But it also means that it's sometimes hard to disentangle what is a well-being economy approach and what's work as usual within the context of Nordic local authorities and regions. We are strongly believing that this has to sit within many agendas and across them. And we also think that this is an approach that does not have a one-size-fits-all. And we come a bit in Sweden, but we have to come a whole lot longer. And we can do that better with our Nordic friends. Interestingly, already in the Swedish constitution, we can see that welfare and the focus of the right to work, housing, education, promotion of social care, security, and good health, etc., are critically written into our Swedish constitution. And thus, I would say well-being welfare is very much at the core. In our work, we have proceeded from that starting point over a couple of years, starting with the region of Stockholm. When that region was formed, as were all regions formally in 2019, there was a long-term strategy that was setting out the direction for the region. The political leadership in the region was then agreeing on we need to have a well-being strategy, a people-centered one that looks across the different portfolios, also together with all the others who are active in the region. And that was what we are developed for them. The local authority of Norrtälje was one of the pilot local authorities, where now it's probably the leading pioneer, having now its third iteration of the budget with well-being at the center of political priority, and now working with it within all the different administrations in the local authority. These experiences and others have led us to be able to invite 4 local authority mayors and 3 regional mayors and their key civil servants to find ways for each of these places to strengthen their approach to well-being, and developing a learning program to try to find what's needed to develop that together with international colleagues. In our understanding of well-being, we both have to see this as a valuable end, because human well-being is inherently and ethically important. But we also have to see well-being as the capabilities to achieve sustainability in all its different forms. We do have to recognize the available sets of knowledge, skills, competences, and psychological and physical abilities available. That's crucial to drive any transformation towards sustainability. And that's also been recognized by UN Research Panel for Agenda 2030 in their Progress Report 2019. It says that human capabilities and well-being is the most important factor for sustainable transformation. However, we don't necessarily state this as clearly as Sarindri Nagendra so clearly says. We have to shift to people being the quality source of strength and focus on that. And Nobel Prize laureate Amartya Sen has a similar idea that we have to find a vision of mankind where we are agents who can do effective things together. UNDP has picked this up in their quote, if equity, innovation, and stewardship become central to what it means to live a good life, human flourishing can happen alongside easing planetary pressures. And that sets particular focus, in my view, on the concepts of mental capital and mental well-being. Because, of course, our being, thinking, relating, collaborating, acting competencies are crucial for this transformation. When we worked with the region of Stockholm, we were identifying available budget indicators and track them, clustered them into those 6 buckets that we can see here, and then looked at how is mental health and well-being related to achieving these outcomes. They are, when we're looking at the reviewed evidence. So mental health and well-being is positively affecting all of these 6 outcomes clusters. And reversely, all of these 6 are also building the available mental health and well-being resources in the population across ages and across sectors. The challenge with well-being is that this is probably something of how it actually works. It's so integrated within all the different parts of decision making, all the different sectors at all the different levels that we run in society. So how do we govern given that condition? First of all, we probably have to find a couple of core lenses for well-being. In our view, we see 3 critical lenses in local and regional government. First, we need to find ways for cross-sectorial shared governance and leadership. If we don't, we're not going to progressing and reaping the benefits out of well-being. We also have to focus on all the age ranges in the population, as well as in all settings where people live their lives. And one particular focus, not the least carried by the pandemic, is the conditions for work for public employees. Without them and their well-being, nothing can really happen. When we're looking at the governance, we have to look at what's available and then strengthen that. So often there is information in the vision and overarching goals. There are cultural elements in place. There are structures and processes, and these can all lead to strategic areas of application. But only, and if only, we're able to find the local cultural position for well-being as a core idea to drive the transformation of the actual local authority and region. So our job is to try to validate what's there and strengthen what's there. So we would like to say that we're working from the perspective of appreciative inquiry to support what's there. And that's something we need to do for each separate organization or administration part to identify how can they act from their particular mandate, responsibilities, knowledge sets with others to drive transformation at different levels, individually, everyday environments, local communities, and the governance levels to make sure that they contribute to what they can to well-being. It means that we have to work very closely to get all stakeholders to be both willing and able, and then work with 4 principles: aligned, synergistic, interdependent, and resilience building. So strength-based approaches that sets every particular situation in focus and find the right approach to well-being within that. It means we might have to change names and concepts and be very attentive to what's there already within education or city planning or parks and recreation. and find their way to contribute to well-being. So some of the areas of work, and I don't think that these really are linear, they are a flow, but they have many forth and backs. So we have to find ways to assess the current state, set goals and priorities, work closely with policy integration, work with then resource allocation to those policy integrated targets, monitoring and evaluation, and knowledge sharing and collaboration. Lastly, the only way forward is by relationships, and they require trust. When we have the relationships, we are able to drive the social change needed. And the core relationships we need have to be between people, between parts of organizations, between communities, between local authorities, between regional authorities, national, Nordic, and international colleagues. So thus, I really hope we can continue to work together on this. Take good care. See you soon.